And ever since I was a teenager, all I've ever wanted to do was to be the voice for people who had no voice. In 2005, our second child was born and diagnosed with phenylketonuria. And 2 years later, we had a third child who was also diagnosed with the same rare disease. Advocacy and public policy takes time, and you can never, ever give up. A lot of people will tell you no, but you still have to continue to push forward and be persistent. And I know that we'll get there for PKU.
As the mother of 3 young men living with rare conditions, I've been a personal advocate for about the last 20 years and professionally for about the last 10. I'm very passionate about continuing to advocate throughout the COVID pandemic to make sure that things like clinical trials continue and are a priority at the FDA despite competing priorities that are happening regarding the pandemic.
My name is Chandra Clark, and I'm the Executive Director of the VHL Alliance. We believe that all patients deserve to live the highest quality of life. Through our advocacy work, we have now had VHL added as a line item in the fiscal year 22 defense budget. It is so important that our patients have a platform and that their voices are heard. We believe in finding a cure for cancer through VHL. Thank you so much for this nomination. We are so honored and grateful.
Well, my name is Mark Yale, and I was diagnosed with mucous membrane pemphigoid in 2007. After being hospitalized twice, undergoing expensive treatments, the financial burden of the disease was immense. I wondered if I would ever have a chance to watch my daughters walk down the aisle when they got married, or share the joy of being a grandparent with my wife. Fortunately, I didn't give up and soon found a community of people with my disease and even a larger community of people with rare diseases. This gave me hope that I could overcome my obstacles and help others with rare diseases. I began volunteering, sharing my experience and disease knowledge, and created even more disease awareness about my disease. In 2013, I attended my very first advocacy event in Washington, D.C., and I was hooked. I know that my focus on these advocacy issues and sharing my story will help provide hope and perhaps even make things easier for those who have yet to be diagnosed with a rare disease.